That's good to know. Okay, let's see, number 10, my last question. You said symptoms are livable before surgery, and I guess that was a typo in the summary. And then
It's about the indication of the surgery, you know. Obviously, there's no question you have a bad back. But we have put these protocols in place that, you know, we do the surgery, you know, from 100 people get to us, only a small fraction get the surgery because we are able to make their symptoms livable. And our take on that is if the symptoms are livable, you shouldn't get surgery. And I think what we generally do, we try to make you feel better with physical therapy, with injections, with bracing and so on. If all of that fails, then we provide the surgery. This surgery took us, I think I can look it up in my record. It took us somewhere around 2 hours, if I'm not mistaken.
Yeah, you told me 2.5 hours.
Yeah,
you were
and
able
it is
to
a very
complete
complex surgery. And it took us 146 minutes, which is 1 hour and 26 minutes.
Oh my goodness.
And this, in the open old-fashioned surgery, this is easily 7-8 hour surgery. And so if, first of all, if other means can make you comfortable, you shouldn't get the surgery. If other means fail, this kind of minimal invasive can put you on a path to get better much faster, much safer by any categories that we have looked at. As a matter of fact, we are publishing our data and it'll be available. It's medical mumbo jumbo, but still, you know, there are information out there for everybody to look at them.
Sure. So my last follow-up question is, did I make the right decision for me?
Well,
Did you?
that is a question for you, comparing to how you were before and how you are just 1 month after the surgery. Did you?
Well, I think I made the right decision, but I wanted to hear you say that yes, you needed this, it was the right decision.
Yeah, well, you know, it wasn't ever a question that you needed the surgery because your spine was twisting and you didn't have the basic quality of life, as she just said.
No.
And it seems that we are 1 month after the surgery. I just needed to put it in perspective. 1 month after the surgery, after open surgery, you still would be miserable.
Sure, sure.
But 1 month after the surgery is not in our medical field where we make a decision, was it worth it or not? Because you may feel in horrible pain 2 weeks after the surgery, and you told me that for 2 weeks he was in pain, and then it was like a switch.
It was just almost like the gals here kept saying about 2 weeks, and after that it just started getting better. And I'm not kidding you, about the 2-week timeline, things started feeling a little bit better for Mark, and you're up and about a little bit, that you're able to tolerate, you know, the usage of his pain meds a little bit better and whatnot. But, you know, and he did, getting back to, you know, the surgery, do I need it or not? He did try every single thing in the book. I mean, it went from PT to several back injections, and you did needling of the nerves or whatever they call it, and all that kind of stuff.
Right.
And we are just 4 weeks after the surgery. I think, you know, I think your disadvantage is you haven't seen the alternatives, and I have.
Yes,
Sure.
right.
I think you're way ahead of the curve, and you have a long way to go, and it's going to get better and better. In medicine, when we answer the question, was it worth it or not, is 1 year after the surgery.
Okay.
We just got our data to publish that. The results are impressive. The amount of the improvement people get comparing to whatever is out there is impressive. So there wasn't you have a scoliosis, you have a severe disc disease, nerves were under pressure. On the medical side, it wasn't even a question. But on the personal side, it's always a different story. And the true answer to that, was it worth it or not, is the question that only you can answer.
Well, I feel like so far so good.
Yeah. We noticed that